I'm very grateful for being given this opportunity to talk. Actually, it's been quite an exercise in humility for me as a politician to listen to you all and the various technical discussions that have taken place. And unfortunately, my partner's made a great deal of notes, I think, for future reference for myself in terms of suggested ways forward. But I wanted to briefly, I think, talk about how I perceive it at the moment in terms of communicating the messages, because I've got quite a contentious thing to say. I think that politics can be a noble profession. I think the job of politicians is to take complex ideas and scientific truths and try and communicate that in as simple and straightforward a manner to ordinary people as we possibly can. So I see our role as being that of an engineer, if you like, in terms of the way that we approach these issues and about how do we get these messages across. I'm very keen to actually take on board a lot of what's been said around here, particularly about stigmatizing, about trying to get the positive message about the need to change. But I also want to briefly talk about the process of change, if I may, and about how we actually achieved that. I think I want to start by being slightly depressing, I'm afraid, about the world outside as things stand at the moment. My perception from talking to people on the doorstep and elsewhere when I get the chance to do it is that people are tired, they're fed up, they're really depressed about lockdown, and they're looking for things that can make their lives a little brighter. And I'm also conscious of the fact that we're going to be talking about moving towards a period of mass unemployment, of people struggling to make ends meet, and for people who are going to be leading quite depressing lives in the first place. And I think it's difficult then to get some clear health messages across. It's all very well telling people, for example, that they should restrict their alcohol intake, that they should give up smoking, and they should control their weight in good times. I think it's even harder when they're suffering from depression and the difficulties of bringing up a family. People in my ward in Broughton take their children to McDonald's, not as a means of just simply filling them with burgers, but as an actual social treat and a means of interacting with them. And we've got to think of positive ways that we can get our messages across without necessarily restricting lifestyles and families to such an extent that it adds to people's level of depression and gloom. And the message is going to be competing, of course, with things like the importance of vaccination, the importance of combating COVID, and the importance of simple things like wearing masks. And I want to concentrate on ways in which we can do that. I think there's a lot we can do in schools, but there is also a lot of things that we've been thinking about that actually add to what we can do as a council. We've been discussing, for example, the role of planning in all of this, how we can control the increase in fast food restaurants, particularly near schools, how we can actually control children's access to convenience foods in that sense. We've been talking about increasing cycleways, about encouraging walking to school. All that has got to be part of the programme. And Janice Lowndes touched on the healthy cooking, about making that a positive thing that people can be involved in, and about how do we actually build that. But there's more to that than that, I think. I think one of the concerns I've got is about exercise at school and about the need to promote that as a positively thing to enjoy rather than a thing to be got through. And I think it comes back to this issue around stigmatizing and this issue around how we are positive in taking those decisions forward. We have a role in delivering all of this as a city council. We can't do it all. We have to listen very carefully to the messages you're giving us, about health and about how we have to change people's lives. But we also have to take account of where people are at the moment and how we actually deal with that and how we actually take them in two key messages. One is that they have to change, but the other is that it's relatively easy to change. I remember dealing with a similar issue on smoking, for example. One of the key messages was the health damage that smoking was doing, but also how quickly some of those effects can be reversed, providing people were willing to make the effort. Because there will be a lot of people in my ward who'll tell me that they are overweight, that they recognize that they're overweight, but it's too hard at their age or whatever to do anything about it. And I think it's getting people out of that sort of level of complacency stroke depression to a situation where they feel positive about wanting to change their lives. I want to thank all of the efforts that all of you are making in each individual clinics and roles that you're playing. I think it's absolutely vital. But our role, I think, is more fundamental than that. It's about changing people's lives completely, about giving them new opportunities and new hope, of which they can access, of which reducing weight is a crucial part of how they make their lives better. So to that end, we are promoting things like the living wage, we are promoting things like better lifestyles, but we're also promoting things like better housing, better environments to live in, and a more attractive, making Salford an attractive place. And I think all of that drawn together becomes a crucial role for the City Council, of which promoting obesity, promoting anti-obesity is a crucial part. Thank you very much.
Thank you, John. A really stimulating input there. Thank you very much indeed. Of course, John has been a councillor in the Broughton ward since 1990, and he took on the leadership of the council back in 2003. He's been our deputy mayor here since 2016. So really encouraging words there from John. We really appreciate it. John alluded to some quite interesting things around the role of the council in terms of things like planning, providing opportunities and hope for people. And I think it's been made loud and clear by both John and this morning earlier by Andy Burnham that they're in listening mode. So come the end of this particular seminar, what we want to do is to collate all of the questions, all of the stuff that's gone on the chat box and the Q&A box. We're going to collate all of that and then make sense of it and feed it all back into the Mayor's office.